What's the significance of wanting more diversity in the healthcare field? What makes it so important? Systemic racism, I would say, is not really a respecter of persons. One of the key ways that shows up really just comes down to healthcare disparities. In 2017, 10.6% of African Americans were uninsured, compared with 5.9% of non-Hispanic whites. 80% of African American women are overweight or obese, compared to 64.8% of non-Hispanic white women. 42% of African American adults over age 20 suffer from hypertension, compared with 28.7% of non-Hispanic white adults. Hispanic women are 40% more likely to have cervical cancer and 20% more likely to die of cervical cancer than non-Hispanic white women. Asian Americans are 40% more likely to be diagnosed with diabetes than non-Hispanic white Americans. And it goes much further than that. The question remains of what type of role would having a more diverse healthcare system even play when it comes to this issue? Hey, my name is Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I want to talk about a very, very important topic. Something that I would say is really central to the main themes of this podcast, and I would say ultimately my own values. It's something that really shows itself quite a lot in a lot of the different episodes of this podcast. And I think even if you look back to a lot of the episodes, you'll find that this theme is just constantly intertwined with a lot of different topics. And that really comes down to diversity in the healthcare field. That really comes down to whether it's care of diverse patient populations in the United States, or even just diversity within the healthcare workforce. I think this is something that is a very key issue and is going to continue to show itself in a lot of different episodes. But in this one, I really want to take a moment to highlight just the importance of this issue. I think a lot of times I bring this up quite a lot on the podcast, but I think the question can easily come up of why exactly is this always being brought up so much? What exactly is the importance of having this diverse healthcare system and healthcare field? And so for this episode, I really wanted to take a moment to really answer that question of what's the significance of wanting more diversity in the healthcare field? What makes it so important? And so with that being said, in this episode, we're going to highlight what's the significance of wanting more diversity in the healthcare field, how is this being done, and also what can healthcare look like in the future with this in mind, especially even as I would say in terms of my own role as someone who's aspiring to become a physician as a black man, and ultimately just really how that plays into diversity in the healthcare system moving on towards the future. And without further ado, let's get into it. So one thing I really want to highlight in terms of the significance of this issue is ultimately, I would say, a greater macro issue that's often being talked about. And that really comes down to systemic racism. See, systemic racism is something that, of course, shows up in a number of different areas. And this is something I think I even remember bringing up in a previous episode of the podcast. Systemic racism can show itself in the form of, as a lot of people talk about, educational disparities, the conversation of police brutality, a lot of different issues where we ultimately see that minorities in this country, unfortunately, don't necessarily have it the same in a lot of different ways. But systemic racism, I would say, is not really a respecter of persons. It's something that shows up in the healthcare field in its own way as well. And I would say one of the key ways that shows up really just comes down to healthcare disparities. And so when I really talk about health disparities, this is really going into how patients from different populations and different backgrounds can potentially have certain health issues and certain health outcomes, and even maybe certain interactions with physicians in ways that may be different from patients that are not minorities. And so I really want to take quite some time to go deep into just a lot of the examples of how systemic racism really shows up in healthcare in the United States. And so in this episode, we're going to go into quite a lot of information. So bear with me, because I think this is really, really important to go into. So the first thing I want to take a look at is a number of statistics that are highlighted in an article on AmericanProgress.org titled Health Disparities by Race and Ethnicity. And so they really just go into just how systemic racism really affects health in a variety of areas. So the first section that they bring up that I want to highlight is health coverage. So looking at the first statistic, they mentioned that in 2017, 10.6% of African Americans were uninsured, compared with 5.9% of non-Hispanic whites. Another statistic, 89% of African Americans had healthcare coverage in 2017 compared with 93.7% of white Americans. 44.1% of African Americans had government health insurance coverage in 2017. 12.1% of African Americans under the age of 55 reported having no health insurance coverage. Looking at chronic health conditions, 13.8% of African Americans reported having fair or poor health compared with 8.3% of non-Hispanic whites. 80% of African American women are overweight or obese compared to 64.8% of non-Hispanic white women. In 2017, 12.6% of African American children had asthma compared with 7.7% of non-Hispanic white children. 42% of African American adults over age 20 suffer from hypertension compared with 28.7% of non-Hispanic white adults. Now looking at mental health, because that's also a very significant aspect of health. In 2018, 8.7% of African American adults received mental health services compared with 18.6% of non-Hispanic white adults. 6.2% of African American adults received prescription medication for mental health services compared with 15.3% of non-Hispanic white adults. In 2018, 3.8% of African American adults reported serious psychological distress. Looking at leading causes of death, which I think is a key model of healthcare when it really just comes to physical health and physical outcomes. The leading causes of death among African Americans are heart disease, cancer, and accidents. African Americans have the highest mortality rate for all cancers combined compared with any other racial or ethnic group. There are 11 infant deaths per 1,000 live births among Black Americans. That's almost twice the national average of 5.8 infant deaths per 1,000 live births, 11.4 per 100,000 African American men, and 2.8 per 100,000 of African American women die by suicide. Looking at Hispanic Americans, health coverage. In 2017, 16.1% of Hispanics were uninsured compared with 5.9% of non-Hispanic whites. 83.9% of Hispanics had healthcare coverage in 2017 compared with 93.7% white non-Hispanic Americans. 39.5% of Hispanics had government health insurance coverage in 2017. 20.1% of Hispanics under the age of 65 reported having no health insurance coverage. In 2017, 7.7% of Hispanic children were uninsured compared with 4.1% of non-Hispanic white, 4% of non-Hispanic Black, and 3.8% of non-Hispanic Asian children. In chronic health conditions, 10% of Hispanics reported having fair or poor health compared with 8.3% of non-Hispanic whites. 21% of Hispanic adults over age 20 have been diagnosed with diabetes compared with 13% of white adults over age 20. Approximately 25% of Hispanics have high blood pressure. Hispanic women are 40% more likely to have cervical cancer and 20% more likely to die of cervical cancer than non-Hispanic white women. In terms of mental health, in 2018, 8.8% of Hispanic adults received mental health services compared with 15.4% of non-Hispanic white adults. In 2018, 4.6% of Hispanic adults reported serious psychological distress. In 2017, the number of suicide attempts by adolescent Hispanic females was 40% higher than that of adolescent non-Hispanic white females. In terms of leading causes of death, the leading causes of death among Hispanics are cancer, heart disease, and accidents. The life expectancy for Hispanics, 81.9 years, is longer than that of non-Hispanic whites. In 2017, the infant mortality rate for Puerto Ricans was 40% higher than for non-Hispanic whites. There are 5.1 infant deaths per 1,000 live births among Hispanic and Latinx Americans. If we look at Asian Americans, 7.3% of Asian Americans were uninsured compared with 5.9% of non-Hispanic whites. 92.7% of Asian Americans had healthcare coverage in 2017. 29.6% of Asian Americans had government health insurance in 2017. In terms of chronic health conditions, in 2017, tuberculosis was 35 times more common in Asian Americans than non-Hispanic whites. Although Asian Americans have overall lower cancer rates than non-Hispanic whites, they have twice the incidence of liver and inflammatory bowel disease cancer. Asian Americans are twice as likely to develop chronic hepatitis B than non-Hispanic whites and are 8 times more likely to die from hepatitis B than non-Hispanic whites. Asian Americans are 40% more likely to be diagnosed with diabetes than non-Hispanic white Americans. They are also 80% more likely to be diagnosed with end-stage renal disease. In terms of mental health, in 2018, 2.1% of Asian American adults reported serious psychological distress. In 2018, 6.3% of Asian American adults received mental health services compared with 18.6% of non-Hispanic white adults. 3.6% of Asian American adults received prescription medications for mental health services compared with 15.4% of non-Hispanic white adults. And to keep going into leading causes of death, the leading causes of death for Asian Americans include cancer, stroke, heart disease, accidents, and diabetes. There are 3.8 infant deaths per 1,000 live births in this population, and in 2017, suicide was the leading cause of death for Asian Americans ages 15 to 24. Now, I can go even deeper in terms of Native groups. For example, the fact that from 2013 to 2015, Native Hawaiians had the highest mortality rate for all types of cancer in the state. I can mention that American Indian and Alaskan Native adolescents are 30% more likely than non-Hispanic white adolescents to be obese. And it goes much further than that. These are just some examples of the health disparities that we see in the United States when it comes to minorities. So I hope all these statistics definitely gave you a really good perspective of just how systemic racism can seriously affect different patients in this country with a large number of different issues, ranging from health coverage to different long-term issues to mortality. There's just so many different statistics that can just go on and on and on. Even looking at some of our past episodes, I remember bringing up the fact that Black women are 3 to 4 times as likely to die during childbirth compared with white women. So there's just a number of different disparities that I often really try to bring up on this podcast that just add on to a lot of these. But I hope this really just shows really the severity and ultimately the importance of considering the fact that there is a serious issue when it comes to health disparities for different groups of individuals in the United States. Now, with all that being said, the question really remains of what does increasing diversity of physicians have to do with this? How exactly does that deal with the issue of systemic racism and health disparities when it comes to the healthcare system? What type of role would having a more diverse healthcare system even play when it comes to this issue? And for that, there's some information that I think you're definitely going to want to stick around and hear. And a lot of that comes from a paper that I actually remember, I think at one point covering on this podcast. It's published on Michigan Medicine's website. It's titled, "Minority Patients Benefit from Having Minority Doctors, but That's a Hard Match to Make." The author is Ryan Wertzel, and I think this can really help provide some key information. So just to highlight a couple things that get brought up in this article, they mentioned that mounting evidence suggests that when physicians and patients share the same race or ethnicity, this improves time spent together, medication adherence, shared decision-making, wait times for treatment, cholesterol screening, patient understanding of cancer risk, and patient perceptions of treatment decisions. So I think ultimately what this shows is that a lot of times when there's a sort of concordance between race of physicians, so when minority patients are being seen by minority doctors, a lot of times it seems to actually improve quite a number of different factors. And I would say one of the things that would play a key role in this would even just bring up a couple examples that I think can play into this, amongst many, is really greater understanding on the part of physicians when it comes to the people that are ultimately treating the patients. I would say some possible examples would even just be more of a cultural understanding. I would say even some shared experiences in this country. I would say a lot of times people coming from similar backgrounds and having a better understanding, whether it may be linguistically or really just in a lot of ways. But those are just a couple of examples to consider. But really, I think a really important thing to highlight here is what they also mention, which is the fact that, not surprisingly, implicit bias from the physician is decreased. And so ultimately, what I want us to take just from this information is the fact that what we find, and even in more statistics I want to bring up, is the fact that really one of the biggest factors in combating these health disparities is having more minority physicians. We see that minority patients benefit from more minority physicians in communities, and that's what we're going to take a bigger look at. And so first, I want to highlight a paper that's titled Patient-Centered Communication, Ratings of Care, and Concordance of Patient and Physician Race. And so ultimately what happened in this study that I want to take a look at is that there was really some research done to look at the communication process in race concordant and race discordant medical visits. So physicians and patients being of the same race and physicians and patients not being of the same race. And what they found here, just to take a quick look at the results, was that race concordant visits were longer, had higher ratings of patient positive effect when compared to race discordant visits. Additionally, patients in race concordant visits were more satisfied and rated their physicians as more participatory. So just taking a quick look at some of those results that were found, you find that ultimately patients seem to benefit and really just have better experiences when it came to physicians that had the same race. And so I would say, I think a lot of this actually comes down to being heard. That's really what I would consider, just as how we saw in the last paper that implicit bias tends to be lower, even when it comes to physicians of the same race. I think that really just shows that a lot of times minority physicians are actually hearing patients better than physicians that are not minorities. To continue to go a little bit further, I want to take a look at another study titled Patient-Physician Racial Concordance and the Perceived Quality and Use of Healthcare. It's in the National Library of Medicine. And basically what they do in this article, as they mentioned, is that they look to determine whether racial concordance between patients and physicians affects patient satisfaction and use of healthcare. To take a look at some details, it mentions that Black respondents with Black physicians were more likely than those with non-Black physicians to rate their physicians as excellent. Hispanic with Hispanic physicians were more likely than those with non-Hispanic physicians to be very satisfied with the healthcare overall. And I would say that a lot of the disconnect that can come could also stem from really a lack of communication. Again, this can really just connect a lot to implicit bias and really just being heard. Looking further into this article, they mentioned that the findings confirm the importance of racial and cultural factors in the physician-patient relationship and reaffirm the role of Black and Hispanic physicians in caring for Black and Hispanic patients. Additionally, improving cultural competence among physicians may enhance the quality of healthcare for minority populations. So again, I think what we just really find is that when it comes to minorities as physicians caring for minority patients, this can really improve cultural competence when it comes to physicians really hearing and understanding patients. Another paper I want to look at that I think is really helpful is titled In Counties with More Black Doctors, Black People Live Longer, Astonishing Study Finds. And what I want to highlight from this is that Black residents in counties with more Black physicians, whether or not they actually see those doctors, had lower mortality from all causes and showed that these counties had lower disparities in mortality rates between Black and white residents. They mentioned that while earlier research suggests that culturally concordant medical care is better and of higher quality for patients, the new study indicates that one factor may be that Black physicians are more likely to treat low-income and underinsured patients, taking on new Medicaid patients more than any other racial or ethnic group, for example. They mentioned that the study found that improvements in life expectancy were greatest in counties with the highest rates of poverty. So ultimately, what this really shows is that, again, more minority physicians are really helping to reduce healthcare disparities. And I would say one thing to consider is that Black physicians, along with other minorities, are more likely to be coming from underserved communities. And so a lot of times you can often find these groups looking to help out underserved communities a lot more often. Now, with all that being said, to really take some conclusions from this, I would just really want to highlight that ultimately what we find is that minority patients benefit from being able to see minority physicians. And one thing that I think is important that I bring up for a second is the fact that I don't necessarily think, and this is even something that I remember, I think even being mentioned in a class, is I don't think this necessarily implies a need for things to be exactly race concordant and Black physicians being with Black patients and white physicians being with white patients and everything being just race by race. But rather, I really think the significance to take out of this is the fact that I think ultimately when you just have a more diverse healthcare system, you get this type of benefit. So ultimately, what I've even noticed to some extent throughout my time, even just being a pre-med and ultimately on this track to becoming a physician, is that a lot of times people from different communities and backgrounds and ethnic backgrounds are often going to glean a lot from each other. That as people are connecting a lot more, I would say even along the medical journey in medical schools and in residency programs, and ultimately just physicians of different backgrounds being around each other, what you're ultimately going to find is there's going to be more of a cultural competence of people better understanding their colleagues and their peers from different backgrounds and ultimately patients from different backgrounds. And what ends up happening is that just simply having a more diverse healthcare system and people being able to hear and connect with each other, naturally they're going to treat a wider range and a much more diverse patient population a lot better. So I've gone through a lot in terms of a lot of the health disparities that exist, in terms of how I think minority physicians really play a key role in combating these disparities. But ultimately, what I want to really take a moment to highlight is what exactly does this look like in the future? What's the significance of this? And really, how do we promote a more diverse healthcare system that can really care for health disparities? And the first thing I want to bring up is I think the importance of identifying the problem. I think that's why a lot of times I do try to bring up a lot of these problems when it comes to health disparities, but also really try to bring up this topic of diversity in the healthcare system and in patient populations and things like this. I think it's important that we're able to really identify the problems that exist when it comes to healthcare disparities. And I think also when it comes to a lack of diversity among physicians. And so for that, I want to really take a moment to highlight something that I think is crucial to understand here. Although I probably haven't brought this up in a very long time of this podcast being around. Ultimately, the reason why this podcast is called Less Than 3% really has a lot to do with the fact that there is such a lack of diversity among physicians. And so I want to highlight a paper that was published on the AMC website. And ultimately, they really highlight this issue, which is ultimately the reason this podcast is called Less Than 3%. And that's the fact that out of all the physicians in the United States, less than 3% of all doctors are made up of Black men, such as myself. And so looking at the AMC's article titled Black Men Make Up Less Than 3% of Physicians That Requires Immediate Action, say leaders in academic medicine. And so additionally, I want to specifically look at a statistic that is found on a UCLA article titled Proportion of Black Physicians in the U.S. Has Changed Little in 120 Years, UCLA research finds. And so we're just taking a look at the statistics that this article brings up. I think it's important that we really understand just why this issue is, because not only is it a fact that less than 3% of all physicians are Black men, it's mentioned that by 2018, when 12.8% of the total population was Black, 5.4% of U.S. physicians were Black, 2.6% Black men, and 2.8% Black women. And additionally, this has changed little in 120 years. So this is an issue that's been around for quite a long time. And so after, of course, identifying this problem, the question remains of really, where does the solution start? And I think there's a couple of things to consider. I think whether it's in terms of health disparities, there's a lot of initiatives that so you try to combat different issues within that. But I think in terms of this issue of there being such a lack of Black male physicians and just Black physicians in general, I would say that I actually think a lot of it even just starts with people like me. I think that's one of the things that inspires me to continue to do this podcast. The fact that we're just being able to increase awareness, we're just being able to try to inspire and encourage a lot of people that may be along the medical path, especially people who may look like me. Really just recognizing that they can play a role in being able to combat issues like this, that in my hard work of aiming to become a physician that can care for patients, and especially even from a lot of different backgrounds, I think that's such a crucial and important part of combating that issue. I think it's being able to really help out and make room and look to create opportunities for more Black men and Black physicians and minority physicians, or specifically people aspiring to become physicians, to ultimately get to that point. And so I think it's just important that I really take the time to really just be able to highlight a lot of these issues that exist when it comes to this topic of just disparities in the healthcare field. And ultimately just for people to be able to see that there's a real issue that needs to be combated, that there's a real place and a real necessity for more minority physicians to really step up and to be able to be a part of that solution. And so I hope in this episode that you were able to gain a lot of information and learn a lot about this issue. And so with that being said, this is something that I definitely want to continue to cover on this podcast. And I hope that you enjoyed this episode. I hope you got a lot out of it. And let's see what we talk about in the next one.